So I think we need to remember that no patient knows whether they need IVF or not. And you don't go to a doctor and say, hey, I require IVF. What typically happens is you go either to a gynecologist or a family physician and say, I'm infertile, I'm not being able to get pregnant, I need some assistance. And then the gynecologist runs the tests, simple tests, take about 15 days to do, things like a sperm test, a blood test to check egg quality, and an x-ray of the uterus and tubes. And then the gynecologist can pinpoint what the problem is and then offer you a solution. One of the big advantages is something called vitrification or freezing, which means we can freeze embryos, we can freeze eggs, and this gives us a lot more flexibility as far as treating patients goes, because you can freeze the eggs for women so they can have babies later on, or you can freeze the embryos so that you don't need to put so many embryos back at one time, or that in one fresh IVF cycle, you can then have multiple transfers so that it reduces the cost for the patients. There seems to be a common misconception amongst people that all IVF babies are twins. And in the past, when success rates were not very good, a lot of doctors would transfer lots of embryos back into the uterus with the hope that one would stick. But when you put 4 embryos back, instead of just one sticking, sometimes 2 may implant or sometimes 3 may implant. And that's why you would have these high order multiple pregnancies or triplets or quadruplets as well. We do what is called a single embryo transfer, preferably a blastocyst transfer, that you have a single baby and therefore the pregnancy is as uncomplicated and full term as possible. I think there is, of course, this thing about, oh God, it costs so much money. And there is, of course, one of the reasons is that a lot of the stuff which we use for doing IVF is imported. These are all disposable. It has to be extremely high quality. We can't reuse it for patients, so it costs a lot. But let me rephrase that question for you. I'm not disputing the fact that IVF treatment is expensive. But if you look at it this way, a baby is priceless. So the question you need to ask yourself is, what is the return on investment in an IVF cycle? Now, it's true that if your IVF cycle fails and you have no baby, you'll say, oh, I spent so much money, it went down the drain. But if, on the other hand, you did get a baby as a result of it, then that's just going to change your equation completely. And I think we also need to remember is that irrespective of whether you get a baby or not, the satisfaction which you get that, yes, I did IVF at a good clinic, I gave it my best shot, I gave myself my best chance of having a baby, will give you peace of mind afterwards that you didn't leave any stone unturned. So you don't kick yourself or have any regrets later on that you did not get the best possible treatment in order to be able to complete your family. Like any other problem, it has a solution. It has a medical solution, and infertility can be dealt with. And that's the good news which infertile couples need to remember.